we are going to look at three different slides. I usually just stick with one slide, but on what I want to show is the difference when we put a slide onto the microscope and do our initial assessment to give us an idea of what a normal white count looks like versus a reduced white count, and then finally an elevated white count. So the one that we have on here, and by the way, I'm on 10x. So this patient has a white count of 10.8. Normal white count is going to be maybe 4.8 to 10.8, somewhere in that range. And we could see here the distribution of white cells on a normal patient. Now, if we go to our next patient, this patient has leukopenia, meaning a reduction in the number of white cells. So there's a slight difference between normal and this particular patient. Okay, now the biggest contrast we're going to see is the leukocytosis that we have in this final one. And this particular patient had a white count of 145.8, which is a critical value. So like this is off the charts. All right, so you can see here clearly this person has an elevated white count. And it's really important that when you do peripheral smears, you do differentials, that you pay attention to every stage. And at this stage, you should be looking, first of all, you should be looking at your analyzer printout before you even look at the slide. And that's going to give you an indication. But remember, things have to make sense. So if your analyzer printout showed a normal white count and you saw this, well, that would be sending off bells, fire bells, that something is not right and that you would need to do something about that.